So good evening, good morning, depending on where you're dialing in from. It's always important to remember that, right? Thank you for joining us today. This is our second webinar in our 2025 disaster series, assessing disaster preparedness and resilience in St. Kitts and Nevis, will be presented today by Dr. Tammy Hall and Dr. Audrey Snyder. We have been very grateful to their time. This is the second time they're presenting today, so we can broaden our audience to the global platform. So for those of you joining, thank you for sharing your time as well. Before we get started, just a brief housekeeping message that we will be holding Q&A until the end. If you have a question, wouldn't want you to forget what that is. Please feel free to use the chat or Q&A feature. Just know that we'll hold that until the presentation is over. Our presenters today, as I mentioned, are Dr. Tammy Hall. She is a nurse educator and researcher with over 30 years of experience in women's health and maternal care. Her research focuses on maternal health, shared decision-making, and disaster preparedness with special attention to rural and vulnerable populations. She has conducted international work in St. Kitts and Nevis, exploring resilience and readiness among communities facing natural disaster. A former labor and delivery nurse, Dr. Hall is now faculty at UNC Greensboro, and presents nationally and internationally on maternal health, rural health, and healthcare equity and nursing's impact on disaster preparedness. Presenting along with Dr. Hall is Dr. Audrey Snyder, who is the Dean of the School of Nursing at Widener. Her area of specialization includes advanced practice nursing, disaster preparedness, resilience and response, public health, international health, community engagement, and nursing education. Dr. Snyder is also a nurse practitioner with Cone Health Palliative Medicine Program and is certified as an acute care and family nurse practitioner. So with that, I'm going to turn over my screen so Dr. Hall can present. I think I need to give you those privileges. And you should be able to share your screen now.
Yes.
Perfect.
Okay, is it up? Yes, great. Welcome everybody and thank you for coming. We are excited to share information with you on assessing disaster preparedness and resilience in St. Kitts and Nevis. And I will turn the floor over to Dr. Snyder.
Well, good day, everyone. Thank you for being here. So we're going to talk a little bit about the research we did in St. Kitts and Nevis, and want to give you a little bit of a background about this federation. It's a two-island nation that became independent from England in 1983. Prior to that, they were considered a British colony. And these islands have a definite Afro-Caribbean culture. It's 104 square miles. The population is now about 48,000. In 2010, when I first started going to St. Kitts and Nevis, between the two islands, there was about 60,000 people. So their population actually is decreasing, not increasing. There's outmigration for many reasons, mostly related to work. They are susceptible to many different types of disasters. Hurricanes are the #1 thing that they're concerned about, although globally, the goal is to be ready for any type of disaster on the islands. They're prone to flooding. There's gouts that water flows from the top of the volcanic mountain down toward the sea, and there are certain streets where it's known, do not park your car here, because with flash flooding, they could disappear into the ocean. Earthquakes are also a factor. Both islands are volcanic islands. They've not erupted for many, many years, but that is a possibility. There are earthquakes occasionally that happen in the region, and I've been there when there's been a volcanic eruption on Montserrat, which caused issues of ash fallout and closure of airspace for airplanes because the ash can shut down airplane engines. And frequently when earthquakes happen, we know there's potential volcanoes to also erupt with that. Drought is a big concern, and last year this was definitely an issue for them in the early summer. This year we've had the opposite issue of having lots and lots and lots of rain, as has most of our region of the United States. Tsunamis are also a potential, and they do have a tsunami warning system on the islands, and the residents are educated about this, especially after what happened in Japan. The work that we do in St. Kitts and Nevis has been based upon a longstanding collaboration that we've had since 2010. I developed a study abroad program that involves both graduate and undergraduate students. And as I've changed universities, we've moved this program along and had it approved in those areas as well. Travel currently is usually mid-May. There's the potential that we end up a couple of days in June. This year we were there just in May. We alternate usually trying to do research one year and disseminate that research and provide education based upon the research the next year. So last year is when this study was done in 2024, and the most recent year before that was in 2022 when we did a evaluation of the impact of COVID on the islanders, as well as looked at food security following the COVID-19 pandemic. So that year we did a double study. We collaborate with the emergency preparedness agencies on these islands. Their NEMA, our National Emergency Management Agency, is the equivalent of our United States FEMA, our Federal Emergency Management Agency. They are responsible for both islands, but underneath them comes the Nevis Disaster Management Department for the smaller island of Nevis. And that department is a very strong department. Sometimes I wonder if it's because they have such a small number of people, especially in leadership roles, that they really need to ensure that they have a good plan. We also work with the area health systems. We work with the Minister of Health, and there's a main hospital and 2 critical access hospitals on St. Kitts, and there is 1 main hospital on Nevis. We've had inter-collaboration between different universities, and the year that this study was done, there was collaboration between UNC Greensboro and the Utah Valley University. We developed this program to be a global health and disaster preparedness course, utilizing the islands as a microcosm to study all types of disasters and to look at their health system, which is quite different from ones that we're familiar with here in the US. They very much have a preventative primary care focus, which ties into preparedness for disasters.
So if you didn't know where St. Kitts and Nevis is, this is the Dominican Republic right up here, and these are the Caribbean islands coming down. St. Kitts and Nevis is located right here at this red arrow. So it's very small. The picture on the right here is a bird's eye view of the islands. St. Kitts is at the top, Nevis is down here. And we like to say that they look like a chicken leg and a chicken nugget. So these 2 islands make up the sovereign nation of St. Kitts and Nevis. So the purpose of our research was to determine the preparedness and resilience of the residents of St. Kitts and Nevis. So we wanted to see if they had the necessary supplies for disaster preparedness, if homes and families had made plans for preparedness, if they have sought out information about being prepared or what to do in case of a disaster, and to be sure that they knew what an effective response would be. Also, by gathering this information, we wanted to know how to inform the residents, to educate them, to find out what types of outreach are needing to be developed to reach even more of the residents, and work with NEMA and NDMD on their disaster planning efforts. So the study was a quantitative descriptive study. We wrote the proposal. We got IRB approval at our university. A Qualtrics survey was written that very closely mirrored other research that was done in the late 2010s. It was made available online so people could access it via a link from social media or from the NEMA and NDMD websites. And also we had the survey available on tablets so that we could make them available for the residents to fill out right there, readily available. We weren't working with paper. We just went straight to the technology and used the tablets. Students helped us, students who went with us on the study abroad trip, helped to gather the information by making the iPads available for residents of St. Kitts and Nevis in central locations such as markets and events that were going on, where the ferry station is, where the pier is, where people gather before they take a ferry from one island to the other, and in major shopping centers and areas. And that's where we did our data collection. Also, undergraduate and graduate students worked together to gather this information. What is really interesting about the students is that they aren't just nursing students. They were students from a variety of different majors, some biology, some early childhood development. We have had biochemistry majors that go along with us. And so the collective is really interesting, but everyone is interested in making sure that these residents are prepared or know how to become prepared. Dr. Snyder? Oh,
So
I can do. Go ahead.
No, go ahead, Tammy.
The residents, as we talked with them, we gave them time to interject their thoughts as well, not just the survey, but we wanted to hear from them. And they had a lot to say about how they were preparing their homes for a disaster, what they were doing with their plans for their animals, whether they were pets or livestock. They talked about the availability of medications and the ease or difficulty in getting a 2-week supply of medications just in case of an emergency. They wanted to talk to us about their specific evacuation plans and what they had discussed with their families, getting a list of their emergency contacts. They talked to us about supporting the differently abled on the islands and how they go about that and the plans for those people. And then they talked a lot about trust in the public officials and looking for guidance from them, guidance and information as disasters were approaching. We did conduct this last May. It was done as a community survey. Again, we did gather at public centers, in markets, and different events. Again, the students used the tablets. We wanted to offer the tablets to the residents so that they were comfortable answering the survey and not using their own data on their cell phone plans to do that, because they had an option to do it on their own device. But we wanted to provide that for them so that they weren't using data that they would have to pay for. Something that was very important for us is that our students were also accompanied by members of the NEMA and NDMD teams, and also people employees and volunteers from the Red Cross. And that was very meaningful for us because these teams have rapport and relationship with the people on the islands. They're very small, and so it seems like everybody knows everyone else. And we were there as visitors, and it was just fabulous to have these team members with us because they instilled trust in the residents that we were doing a good thing for St. Kitts and Nevis. And also before we ever came, they did a media blast explaining that we were coming and that we would be doing research. Participation was totally voluntary and anonymous. There were no identifying questions on the survey, and we got a higher engagement than we thought we would when we started the survey. So we were very grateful. Okay, Dr. Snyder.
So if we think about this time period that we were going to do this, of course, in the United States and in many parts of the world, we've had the concept of, quote, COVID fatigue. And it was interesting because some residents that completed the survey spoke to the fact that they were just tired. They were tired of being told what to do, what they could do, what they couldn't do. And so for some of them, they just kind of had this kind of blinders on to really the need that they should have for being able to become prepared for the next potential disaster. And what we saw was that responses were all over the place. Some residents had very thorough disaster plans. Others had no plans at all and no supplies. Pet and animal planning was really inconsistent. There are a lot of goats, sheep, cow on the islands, as well as just personal pets, as far as dogs and cats. Many of the residents lacked medications for 2 weeks, if something did happen, and many did not have a first aid kit. So that sense of COVID fatigue kind of was woven through some of their conversations and responses.
So our research questions were, what is the state of the community, their community disaster resilience in St. Kitts and Nevis, and what were the factors that affect the community disaster resiliency in St. Kitts and Nevis? And again, we did use technology to gather this information, and the teams made it possible. This is the sample description. The total was 198. After we cleaned up all of the data, we started with over 300, but because there were many that were just not completed fully, and not even enough to get information to use in analyses, we ended up with 198. You will see that St. Kitts has quite a few less than Nevis. And that is because as we were getting our IRB approval, we went to St. Kitts and our IRB approval was not completed until a few days into the trip. So we lost a few days of data gathering while we waited for IRB. But still you see that overall, we had a great representation of the different age ranges. Even people that were greater than 75 were happy to share their information, and they were wonderful to speak with because we heard a lot of really good stories. The gender is described here, the breakdown. You'll see that we had many more women than men that wanted to participate. And we were grateful for them jumping in and doing that. As Dr. Snyder said earlier, this is St. Kitts and Nevis is an Afro-Caribbean island, and so it doesn't surprise us that we had the breakdown, mostly Afro-Caribbean respondents, and then breaking down into other races and ethnicities. Here is the educational breakdown from both islands. And Dr. Snyder earlier pointed out that there are many professional people with professional training because the islands offer free higher education to their residents even after high school. And then here is the breakdown of their monthly income. And you'll see that we had a great representation from every tier of the monthly income. And lastly, we wanted to be sure that we had representation from all districts and parishes of St. Kitts and Nevis. St. Kitts has 8 districts. And so we wanted to be sure that we had representatives from every district, since we were not going out into the communities themselves, but gathering information from the markets and centers on the islands. Those people were coming to the centers and to the markets. And so we wanted to be sure that we spoke with people from every district. And Nevis has parishes, and we spoke with people from every parish on Nevis. Okay, Dr. Snyder.
So we wanted to find out more about what they had for emergency supplies. So we use a common list that comes from many different sources of things that you would want to have on hand in the event of a disaster. So a food supply, water, flashlight, a first aid kit, extra blankets, batteries, fuel, matches, an emergency radio, cling wrap, handkerchief, hygiene supplies, entertainment, especially if children were in the house. And with this, we created a supply score. So we transformed based upon their responses to a supply score that was from 0 to 13 based upon the number of items they actually had at hand in their home. On average, residents had just over 3 of the 13 possible emergency supplies. Some residents had none, and at least one had all items on the list. People were kind of all over the map, though, in how stocked they were, and this is very different from our last survey done in 2019. I think it speaks to that COVID fatigue that they mentioned.
Another question that we had was, what measures have you taken to protect your home from a disaster or hazard? This had 6 specific choices, and then a 7th choice as other, if they wanted to share things that they had done. And that included covering or shuttering windows and doors, reinforcing or weighing down their roofs, cutting down or trimming trees around their house, seeing to it that debris around their home was removed before a wind might come from a hurricane or just a very strong storm, repairing or reinforcing their home, and then having the appropriate supplies to create sandbags in case of a storm or a flood. Similarly, we found that on average, residents had completed just one of the preparedness actions to protect their homes. Many had not taken any actions to prepare their homes. And we transformed this also into a preparation action score for the data analyses. Other meaningful variables that we had included, does your family have a plan in case of a disaster? What is your plan for your pets? Do you have a plan for your pets or livestock? Have you had any personal and professional first aid training? Do you know how to get assistance if you need it? And then do you own your own home? And what is your monthly income?
So the results that we found were that globally, people who were more structurally prepared with actions also tended to have more of the emergency supplies on hand. If they had a family disaster plan and a pet disaster plan, those were independently associated with a significant higher supply readiness in the event of a disaster. And when we looked at, well, if they owned their home versus rented, what level of education did they have, or if they had had any previous first aid training, or their income, whether it be high or low, or their gender, really was not significant. And that was a little bit surprising. We thought maybe the persons who had lower income and would, there would be some significance about that related to the questions, but there was not.
So what we found is we wanted to find out where they were getting their information from, and how meaningful was it that the place where they were getting their information. And we found that those who use the internet to gather information about disasters were 3.6 times more likely to have sought out information within the last year. Those who received their information from the national emergency agencies were over 5 times more likely to seek out disaster information. And then we found those that rely a lot on social media and stay on social media quite a bit were actually 60% less likely to seek out disaster information and hazard information. So this was very interesting to us. These are some of the recommendations that, as we were doing the data analyses, that we were seeing that could be helpful in preparing the residents of St. Kitts and Nevis for disasters and hazards, to strengthen their official information channels. So launching media literacy to the residents, promoting action-oriented campaigns, encouraging family and pet disaster planning, since we saw that that was significant to people being having the supplies that they needed to respond. Improving infrastructure confidence and access. Are your roads, are they easily traveled? Are they free of potholes in case you needed to emergently leave your home and go to higher ground? Target people that are at risk, and those groups such as the differently abled groups, and then evaluate and sustain community training. So those who were interested in doing first aid, having those trainings available. Our group, when we go down every year, teaches the Stop the Bleed program, and we do a train the trainer, where we train healthcare workers, EMS, fire department, how to do Stop the Bleed and how to teach it, and then they can take it out into the greater community. What we found, though, is that as we were doing the analyses and developing this list and telling them, they were jumping right on it and developing these amazing programs and teaching people how to prepare and how to get their family ready, and are they making plans for their pets. So before we could even make it back down to St. Kitts and Nevis to disseminate this information, they were already checking these things off and making sure that they were doing this already. So now we're ready to make a whole new set of recommendations because they've done such a great job at meeting these.
Our study did have some limitations. Of course, we've mentioned that part of this study was replication from one that was done in 2019. And that year in 2019, we actually walked to each of the villages within the communities and shared that our survey. And the survey at that time was paper. So this time we had made the decision that we would try to do it in areas where more people congregated. So the local markets, where they were waiting for the ferry between the two islands, any place where that people gathered, maybe waiting at the taxi stands or at the bus stop. And that may have been a factor because people were less familiar with technology. Also, we did have a flyer that we could post that had a QR code to the link to the Qualtrics survey. And residents were hesitant to scan that because they were afraid of personal information being stolen. So that didn't work out as well. Another factor or limitation is that, we're white female researchers from the United States, and we're not a part of that community. Although we're well accepted in that community, we're not members of their community. So we have to consider that. Having the members of the Red Cross or Nevis or NDMD be with us when we were doing the surveys, they acted as a gatekeeper because everyone knows everyone in the community, and they could have a casual conversation with them, ask them if they would like to participate in the survey as opposed to us coldly asking them. This also was a single moment in time, and that moment in time was also prior to the hurricane season, which could have influenced the responses, considering that there was a hurricane in the Caribbean that skirted the islands right after we left. And then the COVID fatigue that they expressed, I think, could also have been a limitation because maybe they didn't even want to ask a survey question now that they've been pretty distressed from that period of time for the islands, considering that those islands historically had been cotton, tobacco, and then sugarcane production, and those were their exports. And since the sugarcane factory was closed by the government in the late 1990s, the industry became tourism. And when COVID impacted tourism on the island, that definitely impacted their income as well. We also, as I said, did this prior to the hurricane season. If we had done it in the month of August, would our outcome have been different potentially?
So we don't take for granted that we are welcomed there on St. Kitts and Nevis. And so we never want to talk about research there or our involvement there without expressing our gratitude to them, the members of NEMA, NDMD, the Red Cross, but also just the residents in general. We are always welcomed with open arms and treated as if we have lived there for our whole lives. And so we cannot make presentations like this without saying they are just wonderful. And we are so grateful to just be considered a part of what they are doing and providing these services to do research for them.
We didn't really talk about how we develop what we're going to study, but they guide us in that. They talk about what is their concern and what they feel that they need to know. And we had originally said that when we did the earlier survey 5 years prior, that the goal was to repeat that survey, and they really wanted us to repeat that survey, and we added some things that they wanted to know more about, especially the pets and livestock plans by the residents of the islands.
So we are open to questions.
Well, thank you both so much for this wonderful presentation. If there are any questions, you can feel free to use your chat, Q&A, or raise your hand, and we can unmute your mic so you can ask your question live. While we're waiting for some questions, just a simple reminder that the third session in this series will be conducted on September 4th with our colleagues in the Philippines. They will be presenting on Nurses on the Front Lines, Lessons from Disaster, Preparedness, and Response. If you have any questions after the fact, you can always reach out to us at info at grnen.org, and we will be sure to pass that through to our presenters as well. And of course, we always invite you to share the recording. We will archive this on our website by the end of the week. Feel free to forward this to any colleagues or peers that you would also think that would find the information shared today useful. So with that, I want to once again thank you for your time in carving out a little piece of your schedule for us today. Thank you, Dr. Hall, Dr. Snyder. Your sharing of this information is so incredibly helpful, and we appreciate your willingness to present today. Thank you, everyone.
Thank you so much.
Have a lovely day.
Have a good night.
Thank you.